Hi everyone, welcome back to our channel. In today's episode of Clinical Insights, we'll be exploring the rise of virtual psychiatry, which is a very important and timely topic. We're going to be going through pros and cons of online psychiatry, red flags for online psychiatry to look for, as well as things you should look for in a good online psychiatry program. Let's go back all the way to February 2020. I was sitting with my colleagues. One of them is a psychiatrist and one of them is a neurologist. And we were sitting at Starbucks having a conversation. And I started talking about online psychiatry, which was not much popular at that time. And I said, I'm really seriously thinking about it. And I've been talking to my manager about it. And my manager has been resisting, saying, "Oh, doc, it's too difficult, and patients are not going to like it. They want to see people in the office." But I insisted that we have to do it. The psychiatrist was of the opinion that he said, "Imran, it's not going to happen. Don't worry about it. We're going to be retired by then. Next 10 years, it's not going to happen." And the neurologist friend said, "Oh, it doesn't happen. We have to do exams and all that. So it's not going to work in neurology." And I said, "Look, guys, the future is already here. It's going to happen." And then we ended the conversation. We went our ways. Week to 2 weeks later, you know what happened. COVID hit. And my practice was online within 1 or 2 days of that because we had to see patients online. Everybody went online. And this friend of mine, the psychiatrist friend, calls me and said, "How did you know that this is going to happen?" And my response was that I could see that the future is, there's a saying which goes like, the future is already here, but it's only in bits and pieces, so you can't see it uniformly. And now all we can see is online mental health, therapy, online health, outpatient programs like intensive outpatient programs online, psychiatrists online, people not going to the offices and preferring to be seeing patients from home. So it's become rampant. Online psychiatry and therapy has totally revolutionized how people get mental health care. For some, it has made treatment more accessible and convenient, but for others, it has raised some concerns and questions. Can a provider truly evaluate a person through the screen? Can evaluate whether they are safe, whether they can be managed online only without seeing them in person? Is it really possible? Is telehealth psychiatry even safe? Are some platforms really prioritizing speed over appropriate clinical care? So, but where exactly did it come from? And how come it has grown so big? Online psychiatry has been there for more than 20 years, forever. But people didn't realize that. I remember back in 2000, early 2005, the VA healthcare system used to do it. But it wasn't like people would use their phones. It would be more like the psychiatrist or the doctor is in the main hospital and the outpatient clinic is 80 miles away, and patient would go to that clinic and be put in a room with a big TV and a camera, and that's how they would get the treatment. But now things have changed. People use their phones all the time. Everybody's got smartphones and they can talk to their psychiatrist or their provider wherever they're sitting. Now, it is useful because it helps reduce barriers to care, helps eliminate travel time, convenience. People do not have to take time off work. Doctors can work from other places rather than going to the hospital, see patients from home. So there are a number of reasons why it became popular. The original purpose of online psychiatry was to increase accessibility to the patients. For some patients, attending appointments from the comfort of their home helps reduce anxiety around getting help. So it's important to acknowledge that telehealth or telepsychiatry is not inherently bad. In some cases, or a lot of cases, actually, it has helped people get care urgently in the right manner in cases where they may not have gotten help at all. One of the biggest concerns people have is that, can a person be really evaluated psychiatrically online? The reality is that the quality of psychiatric evaluation and care not just depends on whether a person is seen online or in person, but it depends on a lot of other factors like a clinician's experience, their training, their empathy towards the patient, and being able to engage a patient. As a psychiatrist, I prefer to see a patient first time in person because it gives me a lot of data to evaluate, not just what the patient is telling me, but in terms of how the patient walks, what is their body language, how they are in the room and what it makes me feel when I am in the room with the patient. Yes, I can have subsequent visits online, but I at least had the initial evaluation where I saw the patient in person. One of the most important factors in psychiatric care is the thoroughness of the evaluation, meaning having that data which is available to you, which could help you analyze and understand that patient well. The data includes a lot of things like patient's appearance, whether they're engaged, they're able to really tune in with the doctor, as well as the questions, the quality of questions they're going to answer. A provider should be able to expand on what you're describing them as your symptoms, ask detailed questions, explore mental health history, as well as lifestyle changes, be able to go more in depth to review that, as well as to be able to come up with a detailed, individualized treatment plan. Mental health care should never feel transactional or rushed. Another growing concern people have about online psychiatry is medication prescribing. Some people worry that online psychiatry prefers convenience over care because when a person is seen online, basically they're been asked questions about symptoms, and symptoms are categorized into diagnosis, and based on the diagnosis they're being prescribed medications. But good psychiatric provider should not just look at the symptoms, they should look at the person's life, understanding what has caused different symptoms, looking at their lifestyle, looking at the problems, and treating them like a whole person rather than a diagnosis or a disorder. Just to give an example, a person comes in for depression and they cite all the symptoms, one, two, three, four of depression. Therapist or a psychiatrist does not ask about what's going on in their life, factors, problems which has contributed to them feeling depressed is not going to help the situation, because prescription may help them to some extent, but they're not going to change their life. A good psychiatrist or a psychiatric provider is going to want to understand your life, the cause of the depression as well. Yes, it can be genetic, but there are usually circumstances which people have gotten themselves into or done something or had some losses which may have contributed them to feel depressed. For example, somebody may have lost somebody, so they're going through bereavement, and just throwing a medication may or may not be the best option. They may need some grief therapy. They may need to talk about their loved ones who have gone away or the losses they've had, or figure out what has been going on in their life which has caused them to feel that way. Another way is that patients can have their psychological life, understanding them what goes on in their mind when life is happening to them, help them manage problems of life, help them live better rather than just saying they're depressed or having panic attacks and prescribing. That may give a band-aid, put a band-aid on the symptoms temporarily, but for sure, their symptoms are going to come back. Good care should feel like collaborative effort, a teamwork, rather than just checking boxes and giving medications. One of the common concerns people have is, can online care be personal? Because general psychiatric care involves talking about personal things, having the patient actually get a blood pressure, be in the room, see their body language, their gait. For example, when we do mental status exam, we have to comment on person's gait or their tone of their muscles or how they look like or how they were sitting, those kinds of things. And sometimes in online, it's not available readily. I mean, occasionally I've asked patients to show me how they walk, or if there's a tremor, show it to me if I'm seeing them online. But in an in-person setting, providers can get a lot more detail and can tell a lot more things about a patient. Adversely, some people may feel more comfortable from the comfort of their home. For example, in some instances, patients who have OCD getting therapy at home and showing what rituals or behaviors they do to the therapist online can be therapeutically beneficial. In certain forms of therapy, this could really be helpful as well because they are in the environment or situation, for example, hoarding, where that environment could be contributing to the worsening of their mental health issues. So at the end of the day, the connection really matters because in psychiatric care, it's not just the medication or the somatic treatment, but also the connection and the therapeutic relationship, which makes a huge impact as far as the treatment and the prognosis is concerned. Privacy is also a major concern. you want to make sure that you're seeing your provider through a portal or a platform which is HIPAA compliant, because sometimes the data may not be confidential if it is not HIPAA compliant telepsych portal. We should make sure that the environment is private, like a patient is in an environment where there's nobody else unless the patient wants the other person to be in the room. Also, the provider who is interacting with you does not have a lot of distractions or people coming in and going in and out of their room as well, so that the privacy is maintained. It's very important that the focus is on the interaction. People are not distracted. A patient is not having to watch their dog, or the dog is barking in the back, or they're in the car driving, or the provider is sitting talking to a patient and their son gets into the office or into the background. That really creates major problems in treatment, because then the other person is never going to be able to feel safe because they don't know what's going to happen next. So make sure that when you're having these sessions, they're treated as really strictly confidential and the space is very safe. Nobody else is going in and out of the room. Having safe and private environment is not only important for the patients but also for the provider as well. We have a policy that if somebody is in the car, we make sure that we have them park their car in a safe environment and then they can talk. Otherwise, we say we'll have to reschedule, or we want to make sure that nobody else is in the room, because sometimes patients don't care if they have somebody sitting in the back or some close by, but we want to make sure that we document that they are okay with that and there's nobody in the room. And if there is, we document that the patient has given consent for that person to be in the room. That is for the protection of the patient and also for our practices protection as well. If you're considering online psychiatry, there are certain things to keep in mind. Your appointment should not feel rushed. The provider should spend ample of time going over your medications, your history, your symptoms, and be ready to answer any questions. The provider is providing education around medications and treatment and options. Treatment plans should not feel templated or generic. They should be personalized. They should have consideration of other treatment options which are generally not available in online treatments like transcranial magnetic stimulation or Spravato therapy, things of that nature. Online providers should be available through some portal, or at least you can send them a message. If you are not able to reach them, that's a red flag. Quality mental health care should involve collaboration, trust, individualized care, and education. Telehealth can be a great option for people like young professionals who are very busy, parents who can't get away from their kids, people who have transportation problems and live far away, but they should still be seen at least once a year by the psychiatrist or a primary care doctor just to lay eyes on them, to ensure ongoing monitoring and that everything is going well medically and there are no major health issues. There may be situations where in-person care is more appropriate, like if there's a psychiatric emergency, like there is safety concerns. In addition, kids, for example, have difficulty really observing their behavior or have them sit in front of the camera, or geriatric or elderly patients who have difficulty utilizing these complex devices. If a patient is experiencing major emergency or really unstable psychiatric condition, it may be more appropriate to be seen in person. Mental health care is not one size fits all. The right approach depends on each individual needs. At the end of the day, the conversation should not be online psychiatry versus in person psychiatry. The more important question is whether I'm receiving ethical, thoughtful, and appropriate clinical care. The more important question is whether I'm receiving ethical, thoughtful, and patient centric care. For patients who are seeking mental health care, it's important to ask questions, advocate for yourself, and find a provider with whom you are really comfortable. And most importantly, you have a provider who sees you as a human being, as a person, not necessarily just a diagnosis. If you like this video, please write comments, subscribe this channel, and share it with your friends. And let us know in the comment section what topics you would like us to discuss in our future videos. Thank you so much for joining. Bye-bye.